Welcome to this afternoon's webinar. My name is Jenny Steele. I am the Interim Communications Manager at Eurodis, and I'm going to be moderating this. Today we're going to be talking about how to communicate about the results of our COVID-19 survey. I hope you've seen the results that we published last week, and some preliminary results were published over the summer, and how you can use this data for your advocacy needs. So Erwan Bergeronneau is going to present these. He's from our Barometer Voices team, and I'll pass over to him shortly. Firstly, just the technical side of things for the webinar. Firstly, it is being recorded, so be aware of that, and we'll be able to look at it if there's anything you want to go back to. Secondly, make sure you are on mute. We'll come to all the questions at the end. I will be keeping an eye on the chat box, so please write any questions that come up as you go along there, and we'll come back to them. Once the presentation is over, we can open up to discussion, and if you would like to ask a question, then please raise your hand. I think that's everything from me, so I'll pass it on to Erwan to start presenting. And if you've got any questions, then as I said, please put them in the chat.
Thank you very much, Jenny. I am going to share my screen now. So welcome to this webinar. So the idea of this webinar is to share with you the tools and the communication material that you can use to talk about the COVID-19 pandemic, because we've carried out a survey last spring, and you can have the results for your country as a national alliance. And so that's basically what we will be talking about today. So we're going to see three main sources of information. We're going to start with the infographics that were finalized last week, actually, so it's really brand new. We then will be talking about a dashboard that will give us the frequency and percentages for each closed questions that were asked in the survey. And we're going to finish with the open question analysis. So before I go on each one, just to clarify that, so the infographics, it doesn't show all of the questions that we've asked. So we've decided to choose 5 main themes that we believe are the takeaway of the survey. They are presented in a user-friendly manner and are easy to understand. So this is really something that you can use, and we encourage you to use it on social media. It is available in the 7 Eurodis languages. I will get back to that later. Then we'll talk about the dashboard. So the dashboard is a bit different. It's very detailed. You have each question that is analyzed there. You have both the frequency table and the percentage graphic. So it gives you access to the questionnaire, it gives you access to all of the closed questions, and it gives you access to the frequency, which is very important when the sample of the country is too small. And lastly, we're going to see the open question analysis. So in this survey, we asked 2 main open questions about the positive experience that rare disease people had with this crisis, and the negative experience. So we've read all of the answers that people had to this open question. So as a reminder, an open question is like a text box where people can write down in their own words the reality that they're facing. And we've identified themes or categories and sub-themes or subcategories in those testimonies. And so you can have access to that for your country. And we'll also see that there is a possible access to specific quotes. And this is available in 2 languages, English and French. So let's start with a very small reminder of the survey. So the survey on the impact of COVID-19 on people living with rare disease was carried out on from the 18th of April to the 11th of May. In Europe, almost 7,000 respondents took part, and respondents encompassed mostly rare disease patients and carers or family members. It was carried out online and disseminated through social media, through Eurodis Patient Organization Network. And I'd like to thank you all for your work and the fact that you've disseminated the survey. That is thanks to you that we reached that many respondents. So a big thank you for that. And it was translated into the 23 languages that are the most spoken in Europe. So here you have a brief overview of the number of respondents per country. And so I take that opportunity to tell you that as national alliances, you can ask us to have the results for your country as long as there's at least 30 respondents. So you see that for most countries, it is the case. I've put on the right side some countries outside of Europe who reached 30 respondents. And if by any chance your country didn't get that much respondents, we can still work it out by grouping countries. For instance, the Baltic countries, we can group them together to reach 30 respondents. We can do that for other country groupings. So now I'm going to present you the infographics, and you'll be one of the first to see it. So I'm going to go theme by theme. As I told you, there is 5 themes. I'm not going to talk to you about the results. The results were presented by Sandra Courbier in a webinar that is accessible that she did in June. So here we'll be talking about the content of those infographics. So every time it is displayed as such, so you have on the very top the title, how has COVID-19 impacted people living with rare disease? There is then a small sentence that put context to these infographics. So it says a large-scale quantitative survey conducted by Rare Barometer between April and May 2020 about the impact of COVID-19 on the life and care of people living with a rare disease or their carers. Now, in the center is the main takeaway. So here it's 83% of rare disease patients' care that was disrupted. So the first theme is interruption of care. And we have listed 6 different types of care: medical therapies, surgery or transplant, medical appointment, psychiatry follow-up, etc. If you present those infographics, if you will maybe ask about this little asterisk or star that is after each number, and it is to remind us that each of those numbers were recalculated for those who needed this type of care. For instance, surgery or transplant, obviously not everybody needs a surgery or transplant, so we recalculated and excluded the people who did not need a surgery or transplant, and only kept the people who were planning on having an operation within the next weeks. And then at the bottom, we have on the left a little sentence that invite people to visit our website, and if they want to register to the Rare Barometer Voices to take part in future surveys. And when possible, we've also put a quote. So the quotes are an extraction of the open questions. The open question, we're going to see them at the very end. But every time this quote is here to support the idea that is presented in this infographic. So here it's about interruption of care. So the quote says, cancellation of essential consultations, closure of the hospital for non-COVID patients, and due to that, the non-continuation of the analysis essential to its treatment and control. Now, the second theme is about access to hospital care. So the setting is very similar. You have on the top the two logos and the title and the introductory text, and on the bottom this sentence inviting people to visit our website. So you see here that again there is this little star or asterisk after the 47%, 34%, and 25%. It is the same idea. It is to mean that it was recalculated for those who needed to get to the hospital during the first wave. So we had to recalculate that. So if you get this question, that is the answer to give. About the third theme, it's about e-health. So we here present the fact that e-medicine took over from face-to-face when possible. And we have again a quote at the bottom that says, "The doctors with whom I had appointments called me and clarified the current health situation with me on the phone, and then sent me the prescription to save me the waiting time in the consulting room." I thought that was very good. So it's to support the idea that whenever that was possible, given people couldn't, for most of them, see in person their doctors, usually telephone or emails or video calls enabled to fill this gap. The fourth theme that we covered into the infographics is about the fact that it was a very worrying period with uncertainty and fear. We based that on four main topics: the fact that they were not that well informed, that some of them had difficulties in accessing their treatments, that the interruptions of care had a bad effect on patients' health, and that overall the patient health, the mental health, sorry, was complicated. We have a quote here that says, "The first weeks of COVID, I had fears. Suddenly there was no longer much help or contact. Some operations that should have been done have been postponed. I'm really waiting for that. I'm in a lot of pain right now. In addition, I have the feeling that I am on my own." So this one particularly supports the idea that interruption of care had an effect on patients' health. We see here that this patient is in pain, and that it has an effect on mental health, given they feel that they have to deal it on their own. And now the last theme. So the last theme was on the very important role that the close relatives got. So it is to say that family, friends, and neighbors were very supportive during the crisis, and that it was a very important part of the patient's help during this first wave. And we have here again a quote that says, "As I am in total confinement, I was able to appreciate the availability of my friends and neighbors to help me and do some shopping, as well as that of my general practitioner and the staff of the pharmacy where I get my supplies." So that's an overview of the infographics that we've done. So again, you can ask this material for your country. You can ask for it translated, and that's my next point here. So we have two main formats for this infographic. We have the separate parts that we just covered. So we have 5 separate documents that each deal with one aspect of the crisis. And we have all of these combined in one document that is an A4 printable format. It is 3 pages long. I hope you can still see my screen. I'm now sharing the PDF. And so you see that there is a little bit more text. The first page is really to set the context. So we talk about the rare disease here, that there's 30 million people that are living with rare disease in Europe, that there are no cure for the vast majority of the diseases. We have here an introductory paragraph to this document. We have here some key elements the date, the number of respondents across Europe, the number of languages, the different diseases that are covered, and the number of countries represented. And then it's exactly what we saw. It's those 5 themes that we saw that are in a single document. That's the last one. And then a thank you note to the people who participated and the Rare Barometer partner, and a little paragraph on who is Rare Barometer and what does Eurodis does. So I hope you will find those documents useful. Again, you can ask for them for your disease and in your country. So in terms of languages, it will be translated next week. It's currently being translated actually. And so it will be translated into the 7 Eurodis languages. So English, French, German, Spanish, Portuguese, Italian, and Russian. But if you use or you need another language, it's not a problem at all. The only thing is that you will have to translate it yourself, but we will help you with that. So we will send you the infographic text in an Excel document. You will translate the text and send back to us the document with all the text translated. We will implement this translation into the infographics and send you back the infographics translated. Okay, so if you need that, please send us an email. You have our email in our website. It's rare.barometer@eurodis.org, and we will deal with your request happily. Now, I'd like to talk to you more about the dashboard. So the dashboard is really more about a more detailed view of the results. It is much more suitable when you need to do advocacy, when you need to do let's say a PowerPoint presentation and you need to have more precise data. So the first thing I'd like to emphasize is that the infographics do not encompass all of the data, but the dashboard does. So I'm going to here show you some examples of questions that are in the dashboard, but that are not displayed in the infographics. So if you want to do advocacy on the COVID crisis, it is very interesting for you to review the dashboard and check that there is that there may be some questions there that are of high interest to you, but are not presented in the infographics. So this is how it looks like. For each question, you have on the left the frequency table and on the right the percentage graphic. What's interesting as well is that you have the question as it was asked in the survey, so it gives you access to the questionnaire. So here are the following measures currently in place in your country, region, state in order to fight against the COVID-19 pandemic? And then the possible answers were closure of educational facilities, lockdown measures, etc. So every time it's like that for each closed questions. So we had a question on level of threat. That was, what level of threat do you think the coronavirus poses to each of the following? And so now I'm going to just show you the things that you need to pay attention to when reviewing this document. Is that you will see on the frequency table that sometimes the total will drop significantly, and most of the time it is because this particular item was only asked to carers. Indeed, at the very beginning of the questionnaire, people were asked in which capacity they wanted to answer this questionnaire, and they had the choice to answer patient, so they were answering for themselves, or carer, and it was family members. And in that case, they were answering on behalf of the patient. And so here, for instance, you see the person with a rare disease that you care for. It's obvious that this one was only showed to carers. That is why we go from almost 7,000 responses to 2,347 responses. Now, this is another example of what you can see that is not in the infographics. We asked a set of questions on the COVID-19 testing, like where people get tested, yes or no. And so you see that we have this first question, have you been tested for COVID-19? And the very vast majority said no, they didn't, not necessarily because they didn't want to, but because they couldn't as well. And the other question, the one at the bottom, was only asked to those who said yes to the question that you see on the top, plus a similar question to carers. So that is why for the other question, we only have out of 7,000 people, only 500 people who responded, because we asked if the test was positive or negative. So in that case, when your country has, let's say, less than 300 responses, it's very likely that for this question, you won't get 30 respondents. And when that's the case, we don't display the percentage graphic, because it's very dangerous and hazardous to draw conclusions out of very few people. So be careful with that, and that's why the dashboard is very interesting to use, is that it gives you an idea of how many people responded to that particular question. And so maybe sometime it will, you will understand that you need to be extra cautious when interpreting the results, and that also sometimes you won't have the percentages for that particular question. Also, we had a set of questions on social care. So that's an example of a question where I only used the first item. So I don't know if you remember, but on the last theme, I talked about the help of the family, friends, and neighbors. But there were 8 other items that were covered. And so again, if you want to have a look at those results, you need to refer to the dashboard. And that is my last slide on the dashboard. I just want to also mention that we have detailed some answers, and sometimes it's interesting for you, for your advocacy, just to group them. For instance, here we asked, in order to adapt to the COVID-19 pandemic, does your employer allow the following? And the possibility, for instance, to work from home. And we have 3 types of yeses, and we have a no. But the 3 yeses, it's yes every time. It's just that it's for a different reason. For one reason, it was because it was imposed by public authority, or it was because it was advised by public authority, or it was just an initiative for the employer. So that might be interesting for some, but if it's not that interesting for you, you can group it and say that 69% were able to work from home, So don't hesitate to do that when using the dashboard, because we often do that, separate into different subcategories the answers, but in the end, we just might want to communicate about the yes as a whole and not each type of yeses. So I hope that's clear. Now I'm going to move on to the next and last part on the open question analysis. So we asked in this survey 2 open questions that you see on the screen. We analyzed those open questions over the course of the summer, and they were very simple. We asked the people, and they had a text box to answer in their own words. What were their positive experience and what was their negative experience? So the question was very large. As you see, we just said, please report here positive experiences you had in relation to the care received for the rare disease since the pandemic started. please provide as much detail as possible. So people were able to talk about whatever they wanted, and that was very interesting. So what we did is that we reviewed all of the answers, and there were a lot of answers, and we grouped them in themes or categories and sub-themes or subcategories. And that's my next slide. So, for instance, here you have the identified themes on the question on positive experience. And this is how this has to be interpreted. And again, you can ask this table for your country. Okay, so this is the general results, but if you want it for your country, we can sort the result for your country. And this is how to interpret it. For instance, we see that spontaneously 371 people mentioned that as a positive experience, they received remote care via telephone. 145 received remote care via email. 39 talked about work flexibility. 196 talked about face-to-face care this time, but with home visits. So instead of having to get to the hospital or the public facility where they receive their care, people were coming to them, and they found it very good. So that's the part that gets interesting, is that bear in mind when looking at that, is that it was really people's top of mind reporting on the situation. So it gives a lot of insight on what people, what were their greater concerns, you know. And we've identified as well sub-themes. So I'm going to here show you an example. So for instance, on patient organizations and patient groups, you see it's the 126. So we have 126 mention of patient organizations and patient groups as a positive aspect. So here they told us that they found that the patient organizations they belong to were very helpful in the crisis. And we identified subcategories. So 21 told us that the patient organization provided them with equipment and services. 76 that were provided by the patient organization's information. 65, the patient organization allowed them to have discussions, to get mutual assistance, and 2 talked about advocacy. So that is the thing that you can ask us again for your country to have an idea of what people were talking, top of mind. And that is my last slide. We also have quotes. So the quotes that you saw on the infographics, we have them, of course. So that's an example of the quotes. But for the quotes, it's a bit different. We don't give you access to the database of quotes simply because people were talking freely and they revealed sometimes their identity or the identity of their doctor or the center, etc. So what we can do still is, if you need a quote on a specific theme for your country, you can come to us via an email, and we can look at our database, and if we find one, we will send it to you. And if in this quote there's some information that reveal the identity, we're going to hide that and send it to you. Okay, so we think it's very interesting to have this qualitative analysis on the quotes, because it gives more of a story. It makes it more of a story, and it's also always good to hear it from people's own words. And this is only available in English and French, because we had to translate it into our languages, and in Barometer we speak English and French in order to understand them and to analyze them. But of course, if you want to translate it yourself into your language, you can do that once you receive it. I again would like to thank all of the Rare Barometer partners, all of the national alliances, all of the patient associations and patient groups in helping us disseminating the survey. I would also like to thank our partners, among them AFM Téléthon, and the donors that you see on the screen, the donors in 2020. And that concludes it. I thank you very much for your attention. And if there are questions, I'll be very happy to answer them.
Excellent. Thank you, Erwan. That was really informative. If anybody has any questions, then I think you should be able to raise your hand now as well. Or you can put them in the chat and I can ask Erwan. I have a question, Erwan, after that, and I've been close to it, but just in terms of the things to pay attention to, obviously we're dealing with data that, as you said, can't be taken out of context. I'm sure you said it, but if you have any questions on that, we're okay to email you and you'll be able to explain why absolutely. And how.
Yes. Yeah.
Yeah, fantastic.
Absolutely, that's indeed. Yeah, if you have any questions on how to interpret the results, please don't hesitate to ask us by email. Yes.
Excellent. Okay, Mariela has raised her hand, so she can ask a question. Yeah, if you want to unmute, then go ahead.
Hello, I am Mariella, and I am from the National Alliance from Rare Diseases Support Malta. Do you think we can have the Malta results with regards to the Rare Barometer survey, please?
Sure, yes. I have to check if there's at least 30 respondents. That's, one of the requirements, but we can work it out if there is not. Let me just get back to the map and see if we get any in Malta. Yeah, I think it's 36. So yes, of course. Yes.
Thank you. Thank you. Thank you very much.
My pleasure. My pleasure. Yeah.
So you will be sending them to me via email, please?
Yes, I will.
Thank you. Thank you very much.
No problem. Thank you, Maria. Does anybody else have a question? Either raise your hand or in the chat. Seems you've answered everything. Everyone.
Okay, great.
Danielle has a question. Yeah, go ahead. Go ahead, Danielle.
Thank you for this. I was wondering, what kind of communication are we allowed to make around this? Could we post this on Facebook?
Yes.
An article? What kind of article? Newspaper or maybe semi-scientific article?
Well, it's really, once you've asked the results for your country, the results are yours. So that's really the point, is for you to have this advocacy tool. The only thing is always to mention the source of the information, that is Eurodis and the Rare Barometer. But if you use, for instance, this infographics, there are already our logos in there, so that's fine. But if you do mention and use those results outside of, like, let's say on a PowerPoint presentation, we do ask that you mention where it comes from. But apart from that, really, these results are made to be used widely. So please use them on social media. If you need to do presentations for your advocacy, use them. That's really yours. I don't know if that answers your question.
Absolutely. Thank you very much.
Thank you.
Yeah, I would echo that as well from the communication side. Is obviously these are really powerful results that are still very relevant, increasingly relevant in some ways as we're kind of in the second wave. So use them to draw attention to what happened during, how rare disease patients have been affected by the COVID pandemic. Alongside the infographic, we shared a statement last week at the kind of European level to to draw attention to the infographics and the final results, to say that message again, to make sure that rare disease patients are not left behind. So yeah, definitely use them. That's what they're there for.
Oh, and Diane, I forgot to mention, if you use those results and you feel it had an impact, don't hesitate to drop us an email saying that it has been useful to you. We're always interested to know, you know, if it helped you in a concrete way. So we welcome feedback from national alliances or patient organizations on that. Yeah.
Yes, will do. Thank you very much.
Thank you.
Thank you. Are there any further questions? Second. I think it was really powerful as well, seeing the positive experiences and the open questions, and how supportive they can kind of be, and add some more color to the results, which I haven't looked at in detail. So I thought that was really positive for people to bear in mind as well. Are there any other questions from anybody else?
I think that's it.
If that's it, then that's great. We can draw the webinar to a close. As everyone said, you can always contact the team. Do you want to repeat the email address? Just
it's red@barometer@eurodis.org. You can have it as well in our website. That is eurodis/voices. So yeah.
And we'll be sharing the infographics in the translated languages that Erwan mentioned, hopefully within the next week. So keep your eyes peeled for that. Okay, fantastic.
Oh no, there is another hand by Daniel, I think.
Daniel, do you have another question? No, I think that's...
No, I don't.
Okay.
No, I think we just, I think that's from before. Okay, fantastic. Let's draw that to a close then. Thank you so much, Erwan, for presenting, and thank you to everybody for attending and giving your time to learn about how to communicate about the COVID-19 survey results. Have a lovely afternoon and evening.
Thank you, Jenny.
Thank you.